So this is a quick little summary of the proposed IVDR transition and UDAMED rollout. There's some links there. You can go to the press release, the fact sheet, Q&A, and so on. Commission rolled out a number of documents surrounding this particular proposal. And one of the reasons that drove this proposal to actually go back and change the legislation was the situation with the IVDs. And there's actually a pretty good background and a report of where the industry stands with notified bodies coming up to speed and industry preparing for the IVD transition. And then you eventually work your way through that, and you eventually get down to a timing chart where the IVD directive certificates and those products that are receiving a certificate for the first time, those Class Ds, they have until December of 2027 to continue to be placed on the market. And then, additional year for the Class Cs, and then one more year for the Class Bs and the Class A steriles. So this all has to do with IVD extension. And they mimic the changes to be similar to what was in place with the legacy medical device amendment that came out. So you'll see some history there. That's that 2023/607 particular document that came out for medical devices. Now, just like in the medical devices, there is some criteria that IVDs must meet to have this extension. So, well, the good news is we're not going to go through all those particular criteria. We'll leave that for homework. There's a couple at the very bottom that I'd like to highlight, though. One, second from the bottom, is that IVDR regulated QMS. So needs to be installed by May of 2025. So the similar statement for medical devices is this year, May of 2024, but for IVDR, you have the IVDR compliant QMS installed by May of next year. So that's a new qualification that was not in place. And then there are some milestones. So just as the medical device legacy of VIP amendment had a milestone to have the QMS installed and then also engage a notified body, there are, in this case, 3 instead of 1. There's 3 milestones that need to be followed. The first one is May of 2025, has to do with the QMS, or it's timed with the QMS. But that says that you have to have an assessment applied for your notified body, and also have the basic UDI assigned to the in vitro diagnostics. And then a year later, the same is true for those Class C products. In the following year, you'll have the right timing in place for the Class B and 1X. And then that comes as a paired set. So you have to have the assessment applied for with a notified body in May, and then in September of that same year, 4 months later, you need to have it actually executed and signed off. All of that has to do with the IVD portion, those particular provisions. And there's more content in this proposal. The other reason that it was put together and put in place to have the council and parliament approve is to allow legally a concept that they refer to as the EUDAMED rollout. So this would allow individual modules to be declared finalized, and that goes through a process of being audited, and then the commission actually puts an announcement out and says this is now functional. If it goes through those steps, then that particular module then becomes mandatory, and it could be grouped together, it could be one at a time, but there was a number of modules that had been pretty well developed and in use over a couple of years now, and certainly there was industry interest in making use of those. whereas the law said that they had to be delayed until all 6 modules were done. The other thing that I was able to pick up in the proposal is that 18-month period that was mentioned in the question is in fact proposed to be reduced to 6 months, and probably doesn't affect too much of the those in the audience, but notified bodies will have to be aware that the certificate entry period is also decreased from 18 months, but now down to 12 months. And we're going to dive into that in this particular proposal and see what the ramifications of the timing. Noteworthy in the proposal is the wording that says individual modules could be made mandatory as early as the fourth quarter of 2025. So that is quite a significant advance in the timing, 2 years over above what we currently think it would be. So we're going to see all those ramifications. The last thing we'll mention in the summary has to do with a couple other little topics. They talk about coordinated assessments. I'm not going to go into that and take the time to develop that. But the last thing I'll mention here is the supply notice, which is an interesting concept. In this particular clause affects both medical devices and in vitro diagnostics. So this would require manufacturers to give a 6-month notice prior to a particular foreseeable interruption in the supply of that product that might risk serious harm. So there's a little bit of a qualifier there. It would have to be considered by the manufacturer that if this product isn't on the market at a certain period of time, it has to have some significant impact. If it's minor impact, maybe you don't have to give that notice. But anyway, this is a brand new requirement that you ought to be aware of, and you're going to have to put some kind of a note and have people trained and be responsive and have it mentioned in your standard operating procedures and so on.